somebody who's allergic to
Okay, hold on. We got too many
Sorry.
conversations going on at once. Say
The
again.
high on the SPO2
Is 100.
is too high? Too high, though. Is there like a too high number? Because you said a low number would be 90. Get assistance.
No, you can't be too high. That's good.
Oh, okay.
Yeah, too high. Yeah, but that's a good point, Jamie.
Okay.
You can't be too high. Too
Okay.
high. Nobody's too high.
Okay.
100. Everybody's good at 100.
Okay.
It doesn't go 101. You'll never see 101.
Okay. I mean, I didn't know if that was
Yeah.
possible.
No,
so
that's okay.
Oh,
So-
it's percent.
Yeah.
yes.
Got it.
Okay.
How much
So,
oxygen you're
this is
actually
you or me?
Yeah, yeah.
Oh, so it's by percent? Yeah.
It's by percent. So you didn't. I didn't catch that before.
No, because your heart rate's different than mine. Isn't your heart rate different
You're like
than mine?
110%. What?
Woo.
So the other thing, where else could we
Your
put
lungs
that
are operating
probe?
on 100%.
On the toe.
You could put it on the toe, but how gross are people's toes?
Even.
Okay. Might even be more
Well,
gross.
my toes are kind of cute. I don't know.
But your patients might not be.
And a lot is the yellow and stuff from the nails is a lot of patients with long history of medication also.
Right.
And I also, I mean, not that this is anything compared to an RN license, but I have my cosmetologist license. And in school, you have to learn a lot of the basic treatments and what things to look at when you're working on a client. And it's similar, and you had to know, if you see these striations in their nails or they're yellow, that it's because there are a lot of medications. So it's good to, they teach us a little bit about anatomy and physiology there too. You actually have to know that for your state boards. Stuff like that. It's quite interesting what they make you know. You wouldn't think you're cutting hair, you need to know about people's bones and people's heads and their cranium.
So for
It's crazy.
your point though, you guys need to be able to
Yes,
check an O2 sat, okay? So you need to be able to do that proficiently, okay?
One, two.
And so what you need to do is be able to turn this monitor on and off. So this is this green button here.
Yes.
Okay, so make sure, I'm going to turn it off.
You're off.
Okay, so you're off.
Yeah,
Okay,
I'm
now we'll
off.
turn it back on. You need to be able to use that thermometer, one of these thermometers. Okay, you have to be, this is not rocket science, okay? Not difficult. You have to play with the machine and know how to work it, okay? And so that pulse is not the number you ever write down.
Okay.
It's a check. I'm okay with you using it as a check, like, oh, I counted a radial pulse, and this is what I got.
Okay.
And now I'm going to look at that and confirm it. I'm okay with a confirmation of looking at that. Say I had a pulse
Turn it
of
off.
150 on here, and I got 70. What might be wrong?
You could be counting wrong, or you didn't multiply by 2,
Or something, right?
Yeah.
So I mean, it's a good way to check. I think because you guys are new at this, it's a good thing to check it. But
if
you
you have
can't write
150
down
or
that number.
something, yeah.
Don't be the writer down of that number.
Okay. What is the name of the machine?
I don't know.
Really?
SPO2.
SPO2 machine. Are you normal?
This machine?
Good.
Yes.
It's a vital signs machine. I don't know.
It doesn't have a specific
No.
abnormal
What do you
name.
call it?
What's
The
your-
SPO2 machine?
It's a vital sign machine. Call it a vital sign machine.
Okay.
All right, so
Good point.
yeah, I mean, I don't know. Does it have a name?
Well, we have the otoscope and
What's your blood pressure machine? Yes, that you might need to know.
Isn't it
Sphygmanometer.
Worry about that.
nanometers?
sigmometers.
Sigmometer.
It's mom first.
Sphygmanometer.
Sigmometer. I know it's mom first.
It's mom?
Big mom.
All right, guys, we gotta keep
Sphygmom.
going. We're never gonna get done.
Okay.
So now,
Sphygmanometer.
respiratory rate and pulse rate. So if we sit here, we're all going to check our radial pulses. Okay, so what did, and we're going to check apical when we go over there, because we're going to do apical and blood pressures together. So first things first, what does it say to multiply by?
2.
Okay, so, but if it was very irregular, what would you do?
1 per minute.
Okay, just so that you all know, sometimes it's not easy. Did you guys all try to count your own pulses yet?
I tried to do my respiration one.
So what you want to do is you want to be able to feel. Do you think you're going to be able to feel a pulse on everybody? No. What are some issues that might inhibit this?
Poor circulation.
Okay, poor circulation, good.
Too much.
Fluid,
A low blood pressure, very good. Or sometimes when you touch that, it might obliterate with pressure. So like you feel it and then it went away and you're like, what does that mean? That would mean that their blood pressure is probably low.
Okay.
Okay, so it's not always clear cut. And also, have you seen a really, really obese?
Yes.
Okay. So You're like digging through adipose, folks, and so sometimes you can't feel that. Okay, you might not be able to feel it if the wrist is that big. You guys all have pretty normal sized wrists, so go ahead and sit here and let's just be quiet and everybody try to count and see what you get, and then we want to confirm it with the O2 sat.
I think I'm
That's 78.
It's a really long time.
What?
50.
It's a really long time.
What, 30 seconds? Yeah.
Okay, so then what did, okay, so everybody keep counting, or if you're not done, we'll wait. I don't want to talk if you guys are counting.
I thought my watch was working. It's not.
Use that one. Use that one. Yeah, that's fine.
I'm so sad.
Nice, Sissy.
I got this from China.
Sissy.
Yeah.
For the post.
Okay, so guys, we
I
can
just
practice
have-
again
I
later.
don't
What I
have,
want you
like,
to
1 minute,
recognize is
I
that
have
what did it
60
tell you about
30
counting
seconds, 30.
respirations
Time to
in the videos?
Yeah.
How
yeah.
did they show
Oh,
you
I
to
can't
count
remember.
respirations?
Well, you put the arm
The
over
arms,
person,
yeah.
and you hold it,
And
Yep.
you count
and you
the
watch.
inhale and the
Okay, so if you walk into a patient's room, and I love the videos, I'm not saying the videos are not a good thing, I'm not saying that, but you walk into a patient's room and you announce, I'm going to count your respirations now. What are they gonna do? They're gonna breathe funny. So I trick my patients, okay? What I do is I say, oh, I'm just gonna check your pulse. And I count this for 30, or for 60, or I count this for 30 seconds, and then I move on and count respirations by looking at their chest while I'm holding on to them. You can still see it, but I don't have my hand there. If you can see their chest rising.
Yeah.
Do you see what I'm saying? Because if you announce to them, I'm going to count your respirations, people inherently breathe funny.
So
With
your
your-
next 30 seconds you're using on the card.
Oh,
On the respiratory.
okay,
Does that make
okay.
sense?
Yeah, for sure.
I was gonna say,
Because
well,
otherwise, but this is real practice, okay? And I understand why the video says that. If you put a hand over, you can actually see it rising. No one's arguing that. But patients might get nutty and start going, why are you just staring at my chest? Why are you doing that? You know what I mean? Like, people get nervous because most nurses don't take that long, and most nurses do this. So I'll look and I'll feel here, and then I count for my 30 seconds. I stop counting my pulse. I remember that number. And I move on. It might be hard, okay?
Yeah.
Try it. And then move on,
I'll
and then
try.
watch the chest rise and fall. Does that make sense?
Yeah.
So that's just a practical thing that it might be better. And the way you position yourself, did yours confirm what you got? Yes. Okay. Anybody else want to check?
Yeah, I'd love to because I doubt
I
my
think it worked for my
inspector.
It did or didn't?
Well, it's like clearish now.
Yeah.
But I was wondering if that would like.
Wait, does it beep when it's confirmed?
When it's done.
No.
Oh, okay, because I just.
It's like a continuous one.
Okay.
No, I should be on.
Yeah, you're not
And
fast.
normal's really
Yeah.
fast.
So you're probably close. Okay. So
But that makes me
folks,
out of normal. I'm
the
not
next
normal.
thing is, what about, let's go back to the O2 sat for 1 second. You need to have a good blood pressure, and you need to have adequate circulation in order to have that O2 sat work. Okay, so I want you to think about this realistically. I'm measuring oxygen at my fingertip. So if you get a bad number, what are you going to do, other than run to get Kristen?
Check the other one.
I said
Wait,
like,
more.
I would maybe check another finger, sure. Okay, we did that. They're both crappy.
I don't know, a circulation issue at the
No,
extremities.
we don't have an we don't have an ear probe.
Check your machine.
No.
No.
Patient looks a little short of breath.
Panic.
No. That is not the correct answer. What you'd have them
Change their
do
position.
is say, could you take a couple deep breaths, right? So you want them to try to breathe. Say the nurse came in at the same time, or Kristen was in there, and we put oxygen on the patient.
Would you want to listen to them? Because if they have
Okay, wait, I'm not talking that. Yes, you'd want to do all that. That's not the point. The point is we're back on the finger, okay? Back on the finger,
Things
okay?
didn't go well.
And I just want you to understand, practically speaking, you want instant gratification.
So deep breaths.
So we want them to take a couple deep breaths. You don't want to run from the room screaming, okay? You want them to take a couple deep breaths. We want to encourage them to deep breathe. If we get Kristen or the other nurse and the patient's on O2, we say take some deep breaths in through your nose, out through your mouth. And if we sit with that patient and encourage them to deep breathe, say we woke them up and they were sound asleep and their respiratory rate was only 10. And we woke them up, we got them to take a couple deep breaths, this sat probe will likely go up, or the O2 sat would probably likely go up, correct? How long is that going to take?
I don't know.
It's a couple minutes, right?
It's going to have to take a couple minutes.
We need A&P
So people-
too to answer that one.
But what I'm saying is a lot of people want it to change right away.
No.
But how does it change right away? You got to breathe in, it's got to go through your lungs,
Yeah.
through your body, and get
Just
to
kind of like
finger.
starting your car
So
and letting it warm up.
everybody take a relax,
Yeah.
okay?
Yeah.
Because it's not instant. And I think that that's the thing. I would keep the probe on the patient's finger, sit right with the room, or the patient, try to reposition them in a bed.
Yeah.
Half the time, have you seen that kind of overweight, frumpy, crunch down in the bed kind of scenario?
Yeah.
Like if you think about, have you ever seen people where you're like, I want to pull them up and make them breathe better?
Yeah.
Do you know what I mean? Some people have that big belly and they need to be pulled up in the bed, sat up, then they can aerate better. Does that make sense?
Yeah.
So maybe reposition the patient, say take a couple deep breaths, send, Charles to go get Kristen, we got a little issue. It might come up, but it might take 2 to 3 minutes.
Yeah.
Even with encouragement. So people get nervous. It's not going up. And it's like, it's not going to for a few minutes. Okay, so you need a couple minutes after that because the patient has to breathe. I just want you to recognize that if you make an intervention or you do something, it's gotta take a few minutes, okay?
I was gonna say, especially waking somebody up, because if you wake them up and they're scared, oh, okay, their heart rate's gonna go up, and then their heart gonna breathe a little fast.
Yeah, they might definitely. This is the automatic cuff at the hospital. We have these, and we have different sizes, okay? All you have to do is disconnect here. This is actually for a kid or a small adult. Do you think this is going to fit a lot of people?
No.
No, right? This would probably fit most of you guys. But if it didn't, you need to know how to put this on. It says line with the artery, push the button. So you need to practice with that later. Okay, we're going to let you practice with that. Now, you guys need to learn how to take blood pressure. So what have you got? You brought everybody brought a stethoscope or no?
Yeah. Yes.
If not, we do
I'm
have
so.
more.
Where's yours? I want to see yours so bad.
Oh, my stuff?
Your cardio.
Oh,
So get all your stuff out. Yep.
Do you mind if I run to the bathroom really quickly?
Oh, I totally mind.
We can take a few minutes.
You have to go right there.